Our next speaker, Dr. Gonyou, is a fellow at the Michigan Institute for Neurologic Disorders in Farmington Hills, Michigan. She graduated from Michigan State University College of Osteopathic Medicine and completed her neurology residency at Beaumont Health, which is now Corewell, correct? Okay. Dr. Gonyou will be presenting information on MS blood biomarkers and precision medicine. Thank you and welcome, Dr. Gonyou.
All right, well, thank you, Mindy, for having me and everybody at Yoga Moves MS for putting this on tonight. I'm excited to be here and thank you all for coming. So we'll go ahead and get started. I'm talking about precision medicine, AKA biomarkers in MS. So the goals of my talk today are to talk about what biomarkers are, what role they play in MS, the active disease activity test, and then some final thoughts we'll go over at the end. So multiple sclerosis, as you guys know, is a neurodegenerative disease. It's a chronic disease. Although we have many treatments, early treatment is crucial to the disease and to preventing future relapses. One of the major areas of focus in MS research is the identification of biomarkers in the spinal fluid and in the blood. And the goal of this is for individualized disease management and to improve quality of care for patients. When I first had to give this talk, I thought about what are biomarkers? And to me, a biomarker is anything that you can use to monitor a patient's MS. So one thing that we commonly use, and I'm sure many people in this room have had, are MRIs. Another thing that we can do is something called OCT. OCT stands for optical coherence tomography. I'm sure some of you have had it, but basically what it is they shine a light in the back of your eye to get a picture of the retinal nerve fiber layers, and they can measure the thickness of these layers. In MS, we often look for thinning, and this can potentially correlate with disability progression. Another biomarker would be spinal fluid, which you can get from a spinal tap, which we'll talk about in a little bit. And then lastly, another one would be blood tests. So we'll revisit MRI. So like I said before, I'm sure many of you have had MRI. Anytime a patient's coming in with new symptoms, we often get an MRI to determine if a patient's having a relapse. As you can see in this picture here, the patient was given contrast or gadolinium. And you can see that bright white spot on the MRI after contrast. That's a contrast enhancing lesion or an active demyelinating plaque, meaning the patient's symptoms in this case were correlating to a new active MS lesion. Some disadvantages of MRI is it's kind of a snapshot in time. So while today you might have a new lesion or today you might not, that doesn't predict if you're going to have a new lesion in 60 days. Another thing that MRI can't do is we have limited technology to monitor something we call smoldering MS or PIRA. What PIRA stands for is progression independent of relapse activity. And what that means is patients often say, I'm getting worse, but my MRIs are stable. And that's where MRI is lacking and research is headed. The next biomarkers that we'll talk about are spinal fluid biomarkers. So I'm sure a lot of people have had lumbar punctures. I'm sure some people will say they're not bad and others will say they never want one again. So some advantages to biomarkers is it can assist us with diagnosis. So one biomarker is something called O bands or illegal clonal bands, and those can help us make a diagnosis of MS. About 90 to 95% of patients with MS will have this marker. Now, there are other biomarkers that have been found in spinal fluid, but the disadvantage to repeating these biomarkers would be most patients don't want a lumbar puncture every 6 months, and it's relatively invasive. There's one biomarker, there's many, but there's one specifically that they've studied that's been found in spinal fluid and in blood. And that's called neurofilament light. So neurofilament light is a protein. It's like I said, it's found in the blood and in spinal fluid, and it correlates with disability and axonal damage in MS. I'm sure a lot of you are wondering, what is axonal damage? So an axon is basically a nerve fiber that transmits electrical stimulus to control sensation or movement. And in MS patients, these axons can become damaged and release neurofilament light. It's been reported recently that people with MS have about 60% reduction in axons at all spinal levels. While NFL is probably one of the most studied biomarkers in MS, it's also not specific, meaning it can be found in many other diseases. It can be increased in Alzheimer's, it can be increased in ALS, and other neurodegenerative diseases. So while NFL is helpful, it's probably more helpful when you combine it with other biomarkers and put them together. This leads me to precision medicine. So rather than just using one test, to me, precision medicine means using multiple things and putting them together for individualized disease management with the goal of improving quality of care, assisting with diagnosis, and further evaluating disease progression. There is a company called Active that has started doing this. What they're basically doing is kind of redefining the way that we look at MS and doing what they can to make the invisible visible. So the Active Disease Activity Test is a blood test. Active looked at over 1,400 proteins and found that there were 18 specific proteins in the blood that correlate with MS disease activity. This is a quantitative test that's minimally invasive, and it provides a scalable tool to improve MS disease management. What Active does is it combines these 18 different biomarkers, and they use an algorithm to give you a score. The score categories are low risk, moderate risk, and high risk. And what this risk indicates is risk of a new relapse or new radiographic lesion within the next about 60 days. So what I'll show you next is actually an example of an active disease activity test. So if you look behind me, you can see that there's 18 different proteins. So all the 18 different proteins that I discussed, the first one being NFL, that one that we talked about that's found in both the spinal fluid and the blood. That's the first number. The second number, or the second protein, is something called GFAP, which has been found to correlate with MS disease progression. I won't talk about all 16 or I'll be here all night, but there's also 16 more proteins involved in this test. So in addition to giving you a number, they're also going to give you a percentile of where you fall. Now, I know that part can be complex for most patients, and that's why it has this algorithm, which is going to put you into a level of a risk, which I don't have on this page, but that would be that low risk, which is a score of 1 to 4, a moderate risk being a score of 4.5 to 7, or a high risk being 7.5 to 10. So who can get an active disease activity test? And the answer really is any patient who wants to learn about their potential risk of a relapse. If it's something you're interested in, you can ask your neurologist and see if it's accessible at their office. I know that we do offer it at Mind. And then something that's nice about Active is they offer a really nice financial assistance program to make it more affordable for patients. Okay, so I know I talked about a lot, but now let's talk about when we should use biomarkers. I think there's a lot of different areas that these can be useful, but four that I'm going to bring up today. So one is just routine surveillance. What's my number today? And what's my number in 6 months? So something that you can watch over time. Another thing that's interesting is, let's say you're a new diagnosis and you haven't started disease modifying therapy, or maybe you're an old diagnosis and have chosen to stay off. Sometimes it's nice to see what your score could be. And then if you decide to start disease modifying therapy, what's your score after this therapy? Obviously, the hope would be that your score would go down. The next thing would be monitoring for symptoms and relapses. I'm sure a lot of you have noticed over time that you might have an increase in symptoms, but we do the MRI and it's stable. So we say, okay, it's not correlating with a relapse. But during these times, it would be interesting to see how these biomarkers fluctuate. And lastly, it could even possibly be useful to identify patients who are stable, who can safely stop disease modifying therapy. I think that's also a major area of research right now, is deciding, is it okay for me to stop disease modifying therapy? Is there a certain age that I stop? Is there a certain amount of time I've been stable that I stop? And I think right now it's very patient specific, but if they could find biomarkers that could help quantify that, that would obviously be very helpful. So I have some final thoughts. So I still think that there's a lot of research that needs to be done on biomarkers. The test I presented earlier, the active disease activity test, is used for relapses. Something that they're currently researching right now is a number that's more focused on progression or progressive MS, which I think will be useful going forward, as I think it's still a treatment area that we should really focus on. Lastly, how can biomarkers alter treatment plans? And I think the answer is in conjunction with the whole picture, meaning by using the other biomarkers we discussed. So by using MRI and by using your clinical judgment. And I think that these have the potential to really change the future of MS going forward. Thank you.